Hello, everybody, and welcome to the Tuesday edition of Video Clips. And I have some interesting news to share with you as always, but first I'll start with some announcements. We have a children's health seminar on Saturday. It's a local event that we're allowing people to remote into. So if you are interested in attending it, it is scheduled to start at 2 o'clock in the afternoon. Eastern time. And so you can sign up for this. It's $15 to watch remote for this class. And we're going to talk about children's health. And gosh, that's a dreadful topic. We're going to talk about causes of some of the health issues that kids face. We're going to talk about the best diet for kids, some strategies for getting kids to eat right. That's probably the most exciting part about this, is that kids can actually be persuaded to want to eat the right foods. We're going to talk about how to do that. And then, of course, take questions. Don't forget, our conference is this fall, November 3rd through 5th. Only 85 people can join us live in the office to meet the speakers, which include Dr. Vinay Prasad, who is probably, Vinay Prasad, I should say, who's probably one of the most incredible scientists and researchers and medical doctors in the informed medical decision-making space right now. Careers. We have a free workshop coming up on March 20th at 9 p.m. Eastern on independent practice. I'm available for one-on-ones. I have a new newsletter out, and I'm teaching that same week on the Thursday night, a mini clinical skills class. So this is a short version, condensed version of a 24-hour class I teach that will be 3 hours, designed to help you deal with difficult people, how to motivate change, how to problem solve. You can bring your own clients to the table and lots of questions. It's live and interactive, although we will film it. That's on the 23rd. And don't forget, we have marvelous food products that we ship all over North America, and we'd be happy to provide you with a catalog. So my email address is pampopper@msn.com. So as you know, in these videos, I talk a lot about the excessive use of medicine. Medical care is necessary. Sometimes drugs are necessary. Sometimes surgery is necessary. Oftentimes we overuse good strategies. And that's what I want to talk about today, hysterectomy. 1 in 3 women over the age of 60 will be told that they need a hysterectomy by a physician. Women undergo hysterectomies due to a lot of conditions, which include things like fibroids, uterine, cervical, or ovarian cancer, chronic pelvic pain, very heavy menstrual bleeding, pelvic inflammatory disease, uterine prolapse, and endometriosis. Hysterectomy is a pretty profitable business in the medical field, costing an average of $25,000 each, about $16 billion a year in the US alone. It's generally an elective surgery, rarely an emergency procedure. Women are told that there are benefits from it. Painful menstrual periods or incessant bleeding due to fibroids goes away. Older women will avoid irregular periods and discomfort associated with menopause. But there are 2 important questions to ask about this. Is hysterectomy warranted most of the time? And are there negative side effects, which sometimes are never brought up, and they should be? The answer to the first question, necessity, is it necessary most of the time? The answer is clearly no. Hysterectomy is sometimes necessary for cancer patients, for example. But when you talk about things like fibroids, pelvic pain, vaginal bleeding, endometriosis, heavy menstrual bleeding, and other related conditions, these can almost always be resolved with diet and lifestyle change, because the conditions are related to abnormal hormone levels. And hormone production is influenced by diet a lot, particularly the intake of fat, dairy, and alcohol. And by weight status, fat cells produce hormones converted to estrogen in the bloodstream, and higher estrogen levels are the cause of many conditions, including female cancers. The second important issue, side effects, they're rarely discussed, but they should be. Women at the age of or past menopause are often told that hysterectomy involves the removal of body parts that aren't just necessary anymore. You're not going to have any more children, so you don't need these parts anyway. And that's simply not true. Here are just a few examples. After menopause, a woman's ovaries continue to produce hormones, just at different levels than before menopause. Many studies have compared women who've had a hysterectomy and had their ovaries removed to women who kept their ovaries, and the studies show that removing the ovaries increases the risk of coronary artery disease and all-cause mortality. Data from the Nurses' Health Study show that oophorectomy, or removal of the ovaries with hysterectomy, did lower the risk of ovarian cancer, That's a rare cancer, to be clear, and breast cancer, which has a longer term survival rate, but increased the risk of all-cause mortality, coronary artery disease, and lung cancer. Statistically, for every 24 women who have a hysterectomy, at least one woman would be expected to die prematurely from any cause as a result of having it. There are a long list of negative consequences of hysterectomy, both pre and postmenopausal women can suffer from, and those include greater risk of cardiovascular disease and conditions including high cholesterol, hypertension, obesity, cardiac arrhythmias, and coronary artery disease. Long-term effects on the pelvic floor include pelvic organ prolapse, urinary incontinence, bowel dysfunction, compromised sexual function. Vaginal cuff tears are common if the cervix is removed, vaginal thinning and dryness, decreased sexual response, and depression. Complications from the procedure itself include fever, infection, hemorrhage, blood clots in the lungs, and damage to the surrounding organs. To be clear, there are medical indications for hysterectomy, but in most cases, it's not the best choice for resolving issues related to female reproductive health. Women who've been told that they should consider a hysterectomy should first investigate options for resolution without surgery, diet and lifestyle change, for example. For women who should have a hysterectomy, very careful consideration should be given to whether or not to remove the ovaries or oophorectomy at the same time. So basically, hysterectomy is a surgery that can save a woman's life, particularly with certain types of cancer, but it can also ruin a woman's life and cause a lot of unnecessary side effects to solve a problem that really could be resolved differently, and I would argue better. So anyway, discussion that should be had before the procedure, since it is almost never an emergency and it's planned. There's ample opportunity to look at risks and benefits. All right, that's it for today. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you tomorrow with more news.